Stereochemistry. Stereochemistry is the scientific concept that describes the relationship between chemical compounds which have the same molecular formula and identical functional group, but with different three-dimensional arrangement of atoms. These molecules are known as stereoisomers and can have very different properties from one another, particularly when interacting with a biological system. The importance of stereochemistry appears clearly in the synthesis of a drug. Most of a drug, for example, are often composed of a single stereoisomer of a compound, and while one stereoisomer may have positive effect on the body and another stereoisomer may be toxic or inactive. Isomers are compounds that contain exactly the same number of atoms. They have exactly the same empirical formula but differ from each other by the way in which the atoms are arranged. There are two major classes of isomers, including structural isomer, which having different connectivity between atoms, and stereoisomer, which having different spatial arrangement of atoms but with the same connectivity. There are two types of optical isomer, including enantiomer and diastereomer. Enantiomer are mirror image of a curved molecule that are not superimposable. They are optically active, which means having the ability to rotate the plane polarized light either to the left or to the right. Here we have examples including R lactic acid and S lactic acid. Diastereomer. All stereoisomers that are not mirror image of one another, including cis-trans isomer or geometrical isomer. The isomer with the group on the same side is called the cis isomer, while the isomer with the group located on the opposite side is called trans isomer. The trans isomer of compounds are usually more stable than cis isomer. Conformational isomer. Stereoisomer which separated by low energy barrier, and so this isomer can be interconnected to each other at room temperature. The rotation is being around the C to C single bonds. Chirality. Why is chirality important in drug development? Our body is chiral. In biochemistry, many of the molecules that are important in our body are chiral and exist only as a single enantiomer. This including nearly all amino acid and sugar. Therefore, enantiomer of a compounds can react differently in the body with greatly helpful or harmful outcomes. So what is the benefits of knowing chirality and separation of isomer? The benefits including the following: increasing receptor selectivity and potency, decrease adverse effects of a drug, decrease dose given to the patient, decrease potential drug-drug interaction, and increase safety margin. The arrangement of atoms that characterizes a particular stereoisomer is called its configuration. For example, here we have absolute configuration, which including S and R system. The stereocenter are labeled as R or S. Consider the first picture. A curved arrow is drawn from the highest priority 1 substituent to the lowest priority 4 substituent. If the arrow points in a counterclockwise direction, which means left when leaving the 12 o'clock position, the configuration at stereocenter is considered as S, sinister, which means in Latin left. If, however, the arrow points clockwise right when leaving the 12 o'clock position, then the stereocenter is labeled as R or rectus, which means in Latin right. The R or S is then added as a prefix in parentheses to the name of enantiomer of interest. Pantoprazole structure. Pantoprazole is a member of the classes of benzimidazole, that is 1H benzimidazole substituted by difluoromethoxy group at position 5, and 3 to 4 dimethoxypyridine 2-methyl sulfonyl group at position 2. There are two racemic mixtures of pantoprazole, S and R pantoprazole. Pantoprazole, a selective and long-acting protein pump inhibitor, is a chiral sulfoxide that is used clinically as racemic mixture, is-pantoprazole and r-pantoprazole. Animal studies have shown that is-pantoprazole is more potent from 1.5 to 1.9 times and effective 3 to 4 times than racemate in inhibiting gastric lesion. In a human patient, 20 mg of is-pantoprazole would be at least equivalent in efficacy to 40 mg of racemic pantoprazole. The S isomer of pantoprazole was found to be better at inhibiting acid-related lesion because of its stronger inhibition of acid secretion. It is also used in absolute risk reduction for heartburn, acid regurgitation, and bloating. The pharmacokinetics of R and S isomers of pantoprazole vary widely in extensive and poor metabolizer. The use of one compound avoids this variation and offers sure material medical. Here we have a comparison between pantoprazole and S-pantoprazole. The S-pantoprazole protein pump inhibitor used in the treatment of stomach ulcer and gastroesophageal reflux disease, more effective and less depending on cytochrome 2C1. The dosage form equal 20 mg, less side effects, while pantoprazole is the same as S-pantoprazole in usage, less effective and more depending on cytochrome 2C19. The dosage form equal 40 mg, more side effects than S-pantoprazole.
Pantoprazole. What is pantoprazole? Is a proton pump inhibitor that decreases the amount of acid produced in the stomach and decreases gastric secretion. It works by inactivating hydrogen potassium ATPase function in the stomach. Uses and administration. Pantoprazole used for the treatment of gastroesophageal reflux disease, which caused by reflection of gastric secretion such as hydrochloric acid. The second treatment for peptic ulcer disease, which caused by the three reasons of offensive force like pepsin and hydrochloric acid, defensive force like non-steroidal anti-inflammatory drug and nicotine. Pantoprazole is also used for the treatment of Zollinger-Ellison syndrome, which is a tumor cancer in pancreas, especially in G cells, that lead to increased gastrin secretion. Pharmacokinetic. The drug is rapidly absorbed and reaches the plasma about 2 hours after taking the oral dose, and the bioavailability occurs orally at the estimated rate of 77%. The treatment is related to plasma protein, so the drug is metabolized in the liver by cytochrome. The excretion is via urine and feces. Mechanism of action. Pantoprazole inhibits or reduces the jet that secretes proton and enters potassium. So, pantoprazole closes the hydrogen potassium ATPase and binds with hydrogen potassium ATPase by a strong bond called covalent bond. Adverse effects of pantoprazole. The most common side effects with pantoprazole include headache, diarrhea, nausea, stomach pain, vomiting, dyspepsia, vitamin B12 deficiency, and pain in your joints. Pantoprazole drug interaction. There are a few interactions of pantoprazole with levothyroxine, atorvastatin, naproxen, clopidogrel, and aspirin. Warnings. There are some warnings of using of pantoprazole in kidney conditions, bacterial infection, bone problems, and skin problems.